Hey everyone, welcome to another episode of Live with NORML. I'm J.M. Padini, the Development Director for the National Organization for the Reform of Marijuana Laws. It's Friday, August 9th, 2024. You know what that means. It's time for me to answer all of your burning questions live. Hey, thanks for watching today. Take a quick second to hit that like, follow, or subscribe button wherever you're watching so you never miss when NORML goes live. And while you're at it, drop a note in the comments. Let me know where you're watching from. Let me know what your questions are too. Hey Wade, happy Friday to you. Look at all these people over here on Instagram that just joined us. Thank you to you all as well. Hey Scott in Virginia. I'm also in Virginia. Hello, Lake Group Insurance in Minnesota. Hello, hippie and veteran in Washington State. A Lori in Idaho. That's a state. That's a state. Hi, Ellie. Good to see you, friend. I just put mail in the mail to you. Hey, Wade. Again. Oh, hi, Kim. Look at your comment way up there in Kentucky. Hey, Fred and Nova. Hi, same in Buffalo. Hey, Nick, welcome back. But Lori, you have potatoes there. So thank you for your contribution. All right, while you all think of your burning questions, look at that. Ricky, before I even get going anywhere, Ricky, right off the bat, you got one. Okay, Ricky is watching on Instagram, and Ricky asks, hello, what's the best way to help further legalization in Georgia? Okay, first and foremost is vote. If you elect people who are terrible on cannabis policy, you will get terrible cannabis policy. That's just how it works. Georgia does have a medical cannabis program, as I'm sure you know, and there is ample room for improvement there. So, number one, vote. Check out NORML's voter guide. It's at vote.norml.org. It's called Smoke the Vote. So you know where the candidates stand before you give them your vote. Then, after any election, you have to talk to these people, whether you voted for them or not. It doesn't matter. Once they're in office, the deed is done. Now you have to communicate effectively, which typically means in a generally accepted as polite way and a professional way. It goes a long distance in getting your message across. As far as communicating those messages, we have a lot of them already ready to go for you. You can find those in our NORML fact sheets. But those are the big things. Number one, elect people who aren't bad in cannabis policy. Number two, talk to your elected officials once regardless of whether or not you like them or voted for them or whatever, you can talk to them about the policy changes you'd like to see. And it's okay to live in the real world, friends. It's okay to be pragmatic. And it is always okay to not let the perfect be the enemy of the good when it comes to changing cannabis laws. There's a lot of idealism out there when it comes to marijuana law reform, and people want everything and they want it now. And they're not wrong for wanting those things. That's just not typically how the legislative process works. So in Georgia, you've got this really limited medical cannabis program. There's so much room for improvement there. I would strongly recommend focusing your efforts on expanding patient access and expanding patient access honestly covers all of it in Georgia, from the fact that you don't have enough operational dispensaries to having like weird made up lists of conditions. There is so much to do there. So that's where I would recommend you concentrate your efforts. Thank you so much for asking. Hi, Shannon, watching in Wisconsin. Yeah, Lori in Idaho. That's how it goes. But again, it's okay to start with something small and emotionally comfortable for your legislature. You don't have to go big or go home. That's not how it works. It's not how meaningful policy change happens, particularly on what can still be considered a controversial issue like cannabis law. Pick something that provides emotional comfort for your legislature. If it's just a small medical cannabis access bill for some group of people, they got to get their feet wet, and then they can feel good that they did a thing, and then they can want to do more things, especially in a state like Idaho. Look at all those comments over here in YouTube land. Let's catch up with those. Hey, Insulin, talking about Minnesota. Seems like Minnesota has good cannabis policy. I see what you did there. Yeah, we're going to talk about Minnesota actually in a little bit, but probably not in the way that you're thinking. Hey, Aaron, watching on Facebook. Aaron asks, says we could really use you in South Dakota. We need lots of help here. How do we make that happen? Aaron, you can reach me and literally any NORML staffer by emailing normal@norml.org. We all actually read that. But Aaron, just shoot me an email. Just say, hey, JM, and whatever you want. And as long as you send it to normal@norml.org, I will get that. But yeah, I will be putting the South Dakota initiative in NORML's Election Central. You can find that at norml.org/election on our website. And so there will be more information about that effort there. Hey, Christopher, welcome back. Paul, Michael, it's all about your money. Whose money? The money people give to elected officials? Because I kind of agree. Marcy. Marcy is asking, what can we do for Southern Virginia and the use of helicopters? Seems like a waste of resources. If they're using helicopters in SOVA, Marcy, it's not for you or your neighbor, not you personally, but it's not for like the neighbor to see if they're growing 5 plants. It's because they're spending those resources on something bigger. But if you know how to email me, Marcy, so email me. Christopher, I missed you the last 18 weeks as well. Where have you been? I had to do all of your work while you were gone. Hey, Heather, asking about Texas, anything for Texas. So I think we are still waiting to hear what's going to shake out with the local initiative in Lockhart. Dallas is good to go with its local initiative, and then there's Bastrop and Lockhart. And I think I was literally just looking at this on Instagram before. There we go. Thank you, Ground Game Texas, for coming right up. It is. Okay, so Ground Game Texas says the last minute cannabis drama, Lockhart's decrim debate takes City Hall. So I think my understanding is that there's been efforts to sort of chop up that ballot language, and the argument sort of ensued, led by the city attorney. And I don't think that it's necessarily been resolved yet. That's as much as I can see quickly on the internet. But we do have Election Central, and so we'll be adding that as well. That's what I can tell you, Heather, about Texas. Dallas, yes. Lockhart, we're waiting to see what happens. Hey Wade, I'm not certain. Wade says saw in the news discussion over privacy concerns over illegal grows and the utility companies calling them out. Where? Christopher, I can't even read your comment. I love it. Oh, thank you, Wade, in Massachusetts. Yeah, I know that's been a thing in many states. I don't know. Sarah Elizabeth watching on Facebook talking about Indiana. Yeah, it is unfortunate that Indiana does not have access at this point in time. Sarah says it's sad that I work very hard in the state of Indiana just to take that money and spend it in other states. I'd like to spend my money here in Indiana. I think a number of Americans who live in states that don't have legal regulated access feel the same as you, Sarah. You're not alone, and that's frustrating. I know, particularly when over half of the country now lives in a state where cannabis is legal for adults. The good news, Sarah, is that you do have a really great NORML chapter in Indiana. Indiana NORML just celebrated their 50th anniversary a few weeks ago. So if you're not connected with them yet, please do get connected. Hey, Mams, thanks for your question. Mams asked, greetings to you as well. Mams asks, how will the markets in Virginia be impacted by Verano acquiring cannabis? Then goes on to say, it seems in Richmond, prices continue to climb and hours of operation keep getting cut. Mams, I was just talking to a healthcare provider about operations in the Richmond area with the dispensaries and what's going on. I think that because, so right now, it's kind of, it looks weird because they're different names, but they're still all owned by the same company. So the two dispensary names you see in the Richmond area are Cannabis and G Leaf, though they are all owned by Cannabis, which used to be Columbia Care at this point in time. Now they just opened a new store, the Laburnum store, and I think that is taking resources away from other stores, and so we're seeing stores without weekend hours, all the stores closing for 30 minutes for lunch every day. And for some reason, they inflate the prices of other products. So let's say that you're going to buy a Rise product at G Leaf. If it costs $36 at Rise, it might cost $42 at G Leaf. We don't know why, other than it's not their product, so they're marking it up. Like, no shade on you, Cannabis/G Leaf, but if you want to answer these questions, feel free. Yeah, I don't know why they inflate prices, but it sucks, and I think that it has something to do with the Laburnum store opening, the reason why they are cutting hours. They're also probably trying to look a little more profitable, given that they are now in an acquisition agreement with Verano. How do I think that will impact markets? I don't think there's any reason to believe it will have any meaningful impact. Right now, one operator owns those two health service areas, and this would just be another operator still owning those two health service areas, which is not prohibited by existing state law. Will they operate some of the stores better? Let's all cross our fingers and hope. Thanks for your question. I feel like that was a very diplomatic answer. Hey, Casey Patterson, you're doing a startup. Okay. What can you do to help people? Make sure all of your products are tested by a licensed and regulated third-party analytical laboratory that's accredited by a proper accrediting agency. That would be good. I say that. Make sure your labels are honest and accurate. And, if you want to donate to NORML. That'd be cool. There's only one organization that represents cannabis consumers. One. It's NORML. You're looking for an entity that represents businesses. Well, you got so many to choose from. But if you're looking to, support the people that you want to buy your products, there's only one place you can do that. I'm going to take a quick peek over here at Instagram. I missed some of your comments over here. Hey, Ricky. Ricky says, and this is a question. Ricky says the governor is the one who makes the laws in Georgia. The governor is the one who signs the bills that get sent to the governor's desk. So the governor could approve a law or veto a law in Georgia. Well, anywhere. Yes, you do finally have some stores for people to get access to tinctures, but you could have better. You could have more. And I think that's where you have a room for expansion in Georgia, particularly if you partner with the operators there. If you work, there's no reason, unless they're doing something bad to people. I'm looking at you, Missouri. Unless you're doing something harmful, there's no reason why you can't work with operators in your state. It doesn't mean you have to be in lockstep and all have the exact same opinion about everything, but you can collaborate effectively. And particularly if you can collaborate with somebody who has money for lobbying, you can be more effective. Hello, Cultivated Glow, local brand from Minnesota. So. Nat 3B. Maybe that's supposed to be Nate. I don't know. I don't know that this is a hot take. Nat 3B on Instagram says, this could be a hot take. I support legalizing cannabis, but it's also become way too easy for kids to get a hold of, or even young teens who I've watched rot their brains. Truly, I don't know what to do. Cool. So first, I want to thank you for sharing your opinion out loud. Second, I want to direct you to two really important reports that we will talk about during the news, but you can also just find them on the front page of NORML right now. If you go to norml.org, you will see these two reports on the front page. First, I'm going to talk about the one that we wrote about on July 30th, and this is government survey data. This is from the U.S. federal government. This is not my opinion. This is not NORML's opinion. This is federal government survey data. It's a survey they've been doing for a really long time. This survey comes from the Department of Health and Human Services, and it is called the National Survey on Drug Use and Health. This is provided by the Substance Abuse Mental Health Services Administration, SAMHSA, and the National Survey on Drug Use and Health finds that teenagers are far less likely to report consuming cannabis today than they were nearly a decade ago. This is government survey data from the US government that shows a nearly 20% decline in teen marijuana use over the past decade. So it's not actually easier for them to get. You may recognize that it is more available in legal and regulated markets for adults, but that doesn't make it easier for kids to get, because it's being taken off the street corner and put behind an age-verified counter. And you say, oh, well, that's like one huge government study, JM. That's not enough. Cool. The CDC just put out their own report. We wrote about this on the 7th of this week. And this separate report entirely by the CDC highlights the sustained decline in youth marijuana use. And so this is looking at Youth Risk Behavior Survey data, summary, and trends report. This is 2013 to 2023. And in this, they say, quote, 10-year trends are continuing to improve for some areas of adolescent health and well-being, including substance use. Specifically, this report finds that the percentage of high schoolers nationally who identify as current consumers of cannabis fell 26% between 2013 and 2023. So there you go. All of this to say legalization works. It works when you take marijuana off the street corner and you put it behind an age-verified counter. It's grandma's medicine. It's not cool. So, advocate for legalization is what I have to say about that. No one's advocating for legalization for children. It's for adults 21 and older. If someone who's not 21 or older needs access to cannabis for medical reasons, that's a separate issue altogether, and that can be addressed under your medical cannabis program. Someone is asking how to grow a cannabis-related social media Instagram page. Post good content and don't violate the terms of use on Instagram. Instagram likes visual content. Let's check out. Hey, Shogun on Instagram asks, when do you think more grow operators will be allowed in Virginia? When the legislature passes a bill and the governor signs it that allows more licensing. So it does require legislation in order to expand the medical cannabis program. I'm of the opinion this is a worthwhile focus for the 2025 General Assembly in Virginia because the Youngkin administration is not going to let an adult use measure succeed. So there could be an effort to expand the medical program in this next session. That doesn't mean that the governor wouldn't veto that as well. Otherwise, Virginia elections have consequences. And if you don't like the fact that nothing's happened with cannabis, then you can thank the people who elected Glenn Youngkin because you get nothing during his administration. Lori, I'm reading your comment. That's really hilarious. Kayvon, I don't know what your name is on Instagram, but you're asking about marijuana use and neck cancer. I have not seen a recent news stories about this, so if someone has, drop it in the comments. We have reported about that before. So if you go to the NORML website and take a poke around there, you'll see that the reporting we've done on that. Let me see. Let me see if I can just do a quick search using the word neck. What could go wrong? Here, well, that came up. Wow, there's more than marijuana use is associated with a significantly reduced risk of head and neck cancers. That's not a new one. That's from 2009. In 2015, marijuana smoking does not promote head and neck cancer. So there's not a lack of research on this, apparently. So those are my thoughts. Hi, Samuel. I'm having a great day. How about you? Oh, Marcy, that's interesting. Well, it sounds like your friend made some bad choices. Thank you, Samuel. Hello, Ricky. You have entered on the YouTube. Got it. Nick. Ricky says that people bring up politics, not regarding politics. I don't know in what context that is, but I don't really, yeah, you know what? I'm going to say I don't want to hear people's political whining. Like, if you don't like where someone is on an issue, that's fine. But it's not what we hear. We don't, we hear a lot of whining about my team, and it gets tiresome. If your team, not you, not you, Ricky, but like if your team, random person, were so great at the cannabis, then don't you think they'd be doing something? Anyhow, Lori asks, is it true that when the government gets involved in a state's cannabis legalization that they can instill THC caps? What government? I mean, so the state government, because if you are legalizing at the state level, the state government is involved because it's a law, right? So law is part of the government. I kind of get the gist that you're maybe asking about. I don't know. Can you please clarify? What do you mean? Oh, any government? Yeah. So the state government, like your legalization, is going to, you're going to write a law and you're going to try to pass it, whether it's by legislative effort or ballot initiative, whichever your state allows for. And then it is reasonable to use the standard that we use in the United States for cannabis consumer safety, which is serving size. So there's two things. I don't like the word caps. It's not shade on you, Lori, but I don't like the word caps because it, what are you talking, like, we could use more intentional language. Serving size. So when you're talking about a product that you eat, you ingest, right? Like a tincture or an edible, milligrams per serving. That's what matters. The percentage doesn't matter. Milligrams per serving. Total number of milligrams per bottle or per package doesn't matter. The percent per package doesn't matter. What matters is milligrams per serving, and that it is accurately labeled so your consumer can read how many milligrams are in one dose and what constitutes one dose. That's the standard we use in the US. These two numbers that are the most common are 5 milligrams per dose or per serving. It's kind of on the low end, and then 10 milligrams. 10 milligrams is really common throughout the US for serving size. Get out in front of it if you're pushing, if you're trying to legalize in your state, get out ahead of it and put that number in. Don't let someone else decide for you. Don't hand over regulatory authority to an entity that doesn't exist or might be terrible. Just outline it from the beginning. And then there are products that you inhale. And that's where a percent is the appropriate number. The percentage should be on it so the consumer knows what they're buying. But to say you want to limit it based on a percent means nothing other than you don't not you, but means it's the person who thinks that's a good idea does not understand how science works, right? So if flour is only going to get so high in the percentage, that's how it is. Flour is only going to get so high. So let's just take flour out of the equation, although it should be labeled by percentage. Then let's look at concentrates. Whatever form it's in, it's a concentrate. It's extracted from the plant. Now you're going to use this as an inhalant. The percentage matters, right? So that you kind of know what's in it, how strong it is. But when someone says, oh, well, it should only be this percent, because this is a percent I'm emotionally comfortable with. Neat. That's not how it works. When you do that, what that does, number one, if consumers can't get the products they want from the legal market, they get it from the unregulated market, and that does not protect public health. And two, if you're a state like, oh, I don't know, let's say Missouri, where your regulator is making insane choices when it comes to public safety, and saying, oh, let's just allow you to put this really harmful additive in there to dilute your product, right? Missouri, by the way, is saying that they want to increase the amount of vitamin E acetate that's allowed in regulated cannabis products. Gross. None should be allowed. 0. There's a percent you should care about. But other things like, if you have let's say you have a 90% THC extract and you want to put that in your cartridge, but your state says no, it can only be, 70%. What are you going to cut it with to dilute it? And now, should someone be inhaling that? Like, you shouldn't be inhaling medium chain triglycerides. No. So when consumers have a higher potency THC product, just like when a consumer has a higher potency alcohol product, they consume it differently. Now, you might sit down to dinner and have a pint glass of a beer, and that's nice. You aren't similarly going to sit down and attempt to achieve the same enjoyable experience by consuming a pint glass of vodka. You're going to put 2 ounces of it in a cocktail and have a similarly enjoyable experience. The same thing happens with concentrates. It's called self-titration. So yeah, that was a rabbit hole we went down together. Thanks for joining me. You should absolutely have serving sizes and accurately labeled products, but potency limitations are asinine and do not protect public health. Thanks for asking. Oh, Sarah, I'm so glad you're connected with Indiana NORML. That's awesome. All right. Christopher, I'm not. Hi, Daniel. Hi, Daniel. Christopher, I hate your question. I'm going to talk about it, but put that on the back burner. Talk to Daniel first. First of all, hi, friend. Second, Daniel says, have you heard of any hiccups on the new public service employee protections? This is in Virginia for medical cannabis consumption. Yes, I have. Why? Would you like to represent those people? Is that an area of law you'd like to do? Because I could just funnel them to you. Most people just get frustrated and find other jobs. Hello, GE NORML KC's deputy director. Good to have you here. Hi, Ryan. Happy Friday. Mans asked in Virginia what opinion has the best products. It's not region based because they can all sell each other's products. So you could find like G Leaf products in Southwest, but you could find Rise products, thankfully, up here, based on what I hear from people, from medical cannabis patients in Virginia. Hands down, Rise has the best products. That is what consumers say over and over and over again. And I think that's a better way to say it than to say who has the worst products, because I don't want to hurt anyone's feelings today. But people love Rise products, and I don't ever hear the comments that I hear about other products. I don't hear that about Rise products. I've heard that like packaging is difficult to open, but that seems to be a universal issue. GE says, I have a granddaughter who's 14. She tells me that it's not cool when grandpa smokes it. Oh, thank you, Marcy, for letting me know. Marcy says they had a news article that said smoking marijuana will cause mouth and throat cancer. Okay. Thomas, I don't know if First of all, you're a government employee. A state or a federal government employee. And next question, I don't know if Texas has. Okay. I don't know if Texas has medical cannabis employment protections. Get all the words in there. Do I think SAFE will pass this year? This year? As in 2024? Hi, Anne. Skyline, thank you for sending me this kooky article. I wish it would let me. I can't copy it. Ugh. I'm not. CNN runs the stupidest cannabis articles. Christopher. Brian, Brian says, has Chuck Schumer ever contacted NORML to become a member of of our PAC? I mean, we have a PAC at NORML. Is that what you mean? Thank you. Fusion Developer brings up a really great point also regarding serving size and potency effects of serving. Potency does affect serving size, certainly, particularly if you're smoking it and you're smoking, a lot more bio material. You have to smoke a lot more weed. You're experiencing a lot more combustion as opposed to having a smaller amount or no combustion. Marcy, that's really smart to test your homegrown product. Hey, Scott. Scott asks, is homegrown cannabis the only way to ensure you're getting a safe, high-quality product at a reasonable price? No, it's not. It's a reasonable price also may not apply to your home cultivated cannabis, but no, it's not. The other ways to achieve this are through ensuring that your state has consumer-focused regulations that can encompass all of those areas, safety, quality, and affordability. I can say in Virginia that safety, right, when it comes to what can be in your product in Virginia, we have some of the strictest regulations on what can be in a product in Virginia. So you're not getting any vitamin E acetate, Missouri, 0 here, prohibited, twice, double prohibited. You're not getting, pesticide residue or stuff like that. We require organic cultivation in Virginia. But pricing is high. Pricing is high on the East Coast compared to the West, but it's still high in Virginia. Not as high as it was, not the highest, but it's not cheap. Ew. Sarah says, oh, yuck. Sarah says, Indiana love to add the additives to their vapes. THCP. No one should be using THCP. That's disgusting. Yeah, gross. What are the other ingredients? Who knows? First of all, it says THCP on it. It's an unregulated product, and this goes for any unregulated product. It doesn't matter what the labeling says. You don't know what's in it unless you take it to a reputable, accredited, third-party analytical laboratory that specializes in cannabis testing. The package doesn't mean anything. So, ew. Hey, John. Dawn agrees that her patients think Rise is the best. Christopher, our field producer Christopher, agrees that Rise is the best. Sarah agrees that Rise is the best. Good, I wasn't making it up. Ellie also says Rise does a great job. Yes, John, cannabis should be taken off the controlled substances list. Agreed. Their pack. No, Brian, no one has reached out to us about joining their pack, someone else's pack. Yeah. I wish it would let me click your link that you shared, Dawn, but it won't. Okay. I think I've caught up on all your questions except for the one from Christopher that I said I didn't want to answer, but that I would answer. And then we're going to read the news real quick. I'm trying to find it up here. Oh, God. Yeah, I'm going to fire you, Christopher. Okay, Christopher says, what do I think of Trump's position? What do I think Trump's position on Florida adult use will be? Will he turn on DeSantis and support Amendment 3, or will he back hemp? I think he'll try to find out a way to do both. That's my. I can't wait to hear how many words he uses to avoid saying, I plan to vote yes or I plan to vote no. That'll be interesting. I don't think he really cares what, thanks, Dawn. I don't think he really cares what DeSantis thinks at the end of the day. I don't think he cares what anybody thinks at the end of the day. I don't know about that, Nick, but okay. No, Brian. Brian asked if the Veterans Administration can recommend medical cannabis for their patients. Christopher, stop. Okay. Christopher says, I have one more question for you. Been reading about all these genetics, etc. Gets confusing. What type of cannabis would I suggest? Legal cannabis. It's the kind of cannabis I would suggest. Legal cannabis. Although, like, maybe don't go anywhere near concentrates in Missouri. That's what I'm going to say, because it seems like they forgot about the Ebola crisis, where people died from inhaling vitamin E acetate. And they're like, oh, yeah, you can put more of that in your products in Missouri. Also, they high-five themselves for prohibiting synthetics, which, like, great. And they're like, we're protecting consumers. We don't want this unregulated synthetics out there. We're doing it. Yay. But also come by regulated cannabis with something that will kill you. That sounds like a good idea. Woof. Yeah, I wouldn't purchase from them. Okay, let's do some news real quick. Hey, guess what happened in Ohio? If you were living under a rock, then you might have missed that adult use sales began this week in Ohio. The adult use sales are anticipated to generate somewhere between 276 million and $403 million in annual tax revenue in 5 years. So good job, Ohio. Good job getting it done and getting it done ahead of schedule. They had a September 7th deadline, and they beat that. They were like, hey, and it's great because look at Maryland did the same thing. Maryland was like the voters, the governor in particular was like, the voters have spoken. They expect legalization to take effect on July 1. Existing operators, you need to get yourselves together, get ready, getting your application so that we can permit you so you can start selling on July 1. Maryland did it. Ohio just did the same thing. They were like, okay, this is what the voters want. This is when legalization has to take effect by, or when retail sales have to take effect by. Existing operators, here's how you apply to get your dual permit to begin selling. It does. There's no cannabis industry without consumers. None, zero. The idea of the industry being like the end all be all of cannabis policy is, you're important, but if you don't have consumers, you don't exist. So let's maybe not put them at the end of the line all the time. When retail sales happen, it is okay for existing operators to have to start selling as soon as possible. It is fine for that. That is the tried and true path in the United States. It's not to say you can't license new operators. There's nothing wrong with creating economic opportunity for more people. But that's not what legalization is about. Legalization is about ensuring that consumers have access to products that are legal and regulated and safe. And so if you have someone that can start selling sooner rather than later, make it happen. Don't be Virginia. That's just gross and weird. And not in a good way. You do need to get on the ball, Pennsylvania. I don't know anything about Maryland, Samuel. Look, there are other people here who can answer your question about DC and Maryland. I don't think Maryland has the same testing requirements that they definitely don't have the same testing requirements that Virginia does. And I think DC has stronger testing requirements than Maryland does. So maybe make those choices. There's one I'm thinking of in DC that people love, but I can't. Tacoma Wellness. Thank you. That's what I couldn't think of. Tacoma Wellness is the one. Tacoma with a K. That's the one that people really seem to like in DC. I know that they served Virginia patients pretty quickly. Yeah, Sarah, I hope that they can improve the roads with taxes in Ohio and schools. Dark on Instagram asks, how come it's so hard to find RSO in Virginia dispensaries? It's one of the newer product in Virginia dispensaries. I have seen it more and more frequently appear on the menu. So that's what I know. Just look at the menus. If you go to iHeart Jane, you can see all the products, and then you can set an alert that'll tell you when it shows up. Right. Remember how I said we were going to do news? Oh, we did one news. Okay, here's more news. We're going to do it so quick because it's almost 5. This is like these are like stories that you've seen or heard from us before, but cannabis use is associated with reduced in-hospital mortality in heart attack patients. I hope all that made sense for you. People who go to the hospital after having a heart attack, those of them who are cannabis consumers were less likely to die in the hospital than those of them who were not cannabis consumers. Interesting. Hot for Peace asks what's going on with the Senate and bills in New Jersey. Do you mean what's going on in general? I am going to interpret your question, your burning question, sorry, to mean, hey, what's up with New Jersey? What's going on there? Well, let me tell you. Let me look at our action center. I can tell you that there appear to be 7 bills still pending in New Jersey. There's a potency one that we are opposed to. There's a personal cultivation bill that we are in support of. There's a medical cannabis bill to allow nurses to make recommendations. We're in support of that. There's a banking and insurance bill. We're in support of that. There's a DUID bill that we are in opposition of. There's a bill to subsidize medical cannabis for qualifying patients through like Medicaid or family care programs. Supported that. And price cap bill we were in support of as well. You can see all of these, Hot for Peace, thank you for asking. You can find all of these bills in New Jersey and see their exact status. They're all in committee, by the way, at normal.org/act, and then just click on New Jersey on the map. You're welcome. Thank you for asking. Heart health, yes. Christopher, Jesus. Deceased. Okay. Can't wait to hear your comments for the rest of these, Christopher. Okay. This next study is about patients turning to cannabis to treat a chronic skin condition. It's referred to as acne inversa, and the researchers suggested that cannabis may play a role in analgesia, improved quality of life, pain, itch, and overall mental health improvements in patients with this particular disorder. Check it out. We're doing so well. Speaking of, stop me if you've heard this one before, because you have, but here it is in another version. Most patients and healthcare providers report that cannabis reduces opioid use. You don't say. But here's another one to throw on the pile. This survey is actually very well done, and it was done by the New York State Office of Cannabis Management. I really like their surveying their patients and providers on that particular issue. Get away from my door. Oh, it's someone I know. Still. Okay. Yes, exactly, Christopher. Exactly, Skyline. Exactly, Marcy. Yeah, we talked a little earlier, if you were here, replication. Yes, Scott, replication is one of the scientific pillars. We love to report on the same things over and over again because they matter. Because people are still making ridiculous claims like, oh, if you legalize it, it'll make it easier for kids to get it, even though the federal government, 2 separate entities in the federal government in less than 10 days apart have said no, that's not what happens. In fact, there's steep decline. The CDC data as we talked about earlier, came out just days after the publication of the most recent national survey on drug use and health. Um, both of them similarly identify significant decline in cannabis use by young people. So check that one out. I didn't put a little thing with that one. We'll just make it be this. So two things happened. I'm sure more than two, but here are two things that happened this week in weed with states. Minnesota launched its first ever cannabis research program. This is the University of Minnesota School of Public Health Cannabis Research Center. You can read all about it on the NORML blog, and I even went to their webpage to see it, to check it out with my own eyes. It's there. Because they're drinking more. Mm-hmm. Thank you, Nick. Okay, and then the last little. We did that so quickly. The last little blurb about some state action here comes to you from New Hampshire, and lest I be accused of being partisan, the Republican governor of New Hampshire did something good. Governor Sununu signed a pair of bills that will significantly expand medical cannabis access in New Hampshire. So one of the bills, super important, is a let doctors decide bill, is how we would sort of refer to that. And what it will do is that gives discretion to the healthcare provider who issuing the medical cannabis recommendation, and says you can issue this to any patient that you think might benefit from medical cannabis, whether or not the patient suffers from a specific disorder. Look, making up a list of conditions is weird. You don't need to be doing that, states. If you're in a state that has a list of conditions that says, well, I think you deserve medical cannabis, but if you don't have one of these special disorders, you don't. You should just go to jail or pay taxes on cannabis, like whatever it is, pay higher prices. Why are we, it's 2024. Why are we making up lists of conditions? If I need an antibiotic, you know who my doctor doesn't call? My senator, to ask if it's the right one. If I have to have surgery, my surgeon's not calling, my member of the House of Delegates to make sure that I have the right disorder for that surgery. That's insane. Healthcare providers make these choices for far more dangerous substances. They're best situated to make those same decisions about who gets a medical cannabis certification and who doesn't. Not your senator or your House member or assembly member or your regulator or your equally weird little conglomerate of people that advise your regulator. None of that should be happening. That's gross. Stop. Let doctors decide. Full stop. Do that. There's a bill. If you have a weird made up list of conditions in your state, run that bill. Go to your doctor's group and say, hey, don't you think you should be able to make these decisions for your patients? Don't you think you're best situated? That's what we did in Virginia. In fact, we went from one condition to none. We didn't hang any ornaments on the tree. Oh, okay. It's just that one. One of the Instagrams kicked us off. Yeah, so do that. We had a doctor in our a senator who was a physician, and she carried the bill for us, and she was an excellent champion of this issue. And that's why we were able to pass Let Doctors Decide and to go from one condition to no made up list of conditions. You can do it in a state like this one, you can do it in yours, unless maybe you're in Idaho. Okay. Christopher. Okay, did I do all of the stories? I did them all. Yay, yay, good time. Good job. Hey, NORML's weekend read comes out tomorrow. And if you like these stories, you can just get them delivered to your inbox every Saturday. You can get them Thursday and Saturday. Head to norml.org/subscribe. Make sure you check the weekend read box so you get the Saturday issue as well. Do it. Do it, do it, do it. You heard me talk about our voter guide. It's called Smoke the Vote. You can find that at vote.norml.org. And if you would like to follow along, of course you would, with all of the election information as far as ballot initiatives and what's going on with those, how to connect with campaigns, final outcomes are, you can follow those and NORML's Election Central at norml.org/election. What other things do I want to tell you about? One more thing. Do you know we have a web store? We do. You can get cool stuff there. You should. You can find it at store.norml.org. Yeah. Did I answer all the questions? I did answer all the questions. And then let me tell you about a few events that are coming up. Oh, Nick, please. Okay. On Sundays, Sunday, our Suncoast NORML chapter, it's a chapter out of Florida, Suncoast NORML does The Rotation live, streams live on YouTube at 11 a.m. Eastern. You can find Suncoast NORML on YouTube and watch The Rotation there. Coming up in September, you all are kind of, dial it down on YouTube. Let's stop. Lehigh Valley NORML is one of our Pennsylvania chapters. They are having their annual picnic on September 7th. You can find Lehigh Valley NORML on Facebook and the internet. If you don't know where to find them, go to norml.org/chapters. But they're having their annual picnic on September 7th from 11 to 7. Thank you for putting that on Facebook so it's easy to find. If you are a NORML chapter that's watching and you're like, why didn't they say anything about my event? It's because I don't know about it. So send it to me and make some sort of page for it. And then last but certainly not least, who wants to hang out in Key West? That's what I thought. You can, because we'll be there December 5th through 7th at the 2024 NORML Key West Legal Seminar. If you are a practicing attorney who needs continuing legal education credits, cool, we got you. Our legal seminars are fully accredited in every state that requires CLEs for their attorneys. If you don't need the CLEs, or you're not an attorney, okay, if you don't need the CLEs, or you're not an attorney, we still got you. We got you with a discount. So do it. Register. Head to normal.org/Key West. Check out the amazing lineup of speakers and topics that we'll be covering. Make your hotel reservation. Make sure you register for the seminar as well. And then come hang out with me and Paul and Keith in Key West and meet legal experts from all around the country specializing in cannabis law. Yes, Marcy, both of these statements are accurate. Florida does need to pass Amendment 3. If you or anyone you know lives in Florida, the answer is yes on 3. Yes on 3. Yes on 3. And the answer for Virginia, Virginia could have had adult use retail sales, should have had adult use retail sales by now, but doesn't because the voters made a really poor choice for governor. And Virginians made a really poor choice in trusting some Democrats with their decision-making ability. Everyone is to blame. Everyone is to blame. The Democrats who were in power prior to the Youngkin administration, they made bad choices, terrible choices. Retail sales should have begun. It should have been part of that bill. It did not need to be severed out because there's this wild claim out there. I know you've heard me talk about this before, Marcy, that like, oh, well, we couldn't have gotten the bill done if it also had sales in it. We had to take it out. That's called liar, liar, pants on fire. Your whip count is not the only whip count. So bad choice, Democrats, and then you lost the administration and you couldn't get anything through the House or the administration, and then you took back the House. Okay, great, but now you can't get anything through the governor. Stop making stupid choices. And to the current governor, what is wrong with you? Like we're so past the point of even trying to pretend like I need to be cordial. Like, get over yourself. You want to protect children? I don't know, maybe spend 5 minutes having any modicum of understanding about cannabis policy and the real world effects of cannabis regulation in the United States. I don't know. Let's look at like what the CDC or HHS says. You okay with either of those federal agencies? If you want to protect children, you have to take marijuana off the street corner and put it behind an age-verified counter so they have less access to it, not, whatever you have going on in Virginia now, which is a free-for-all. Thanks for getting me up on that soapbox, Marcy. Christopher, no, there is no update on Schedule 3 being finalized or a rule being published. Absolutely none. The public comment period, as you know, has closed. We submitted our public comment. I'm sure you submitted yours as well. We are aware that there have been multiple requests for administrative hearings, and it is entirely likely that there will be administrative hearings granted. And then, of course, Christopher, we have to look at the outcome of the November election, which could significantly influence the trajectory of the rescheduling effort. No, he's not doing anything, Marcy. Bye, Scott. No, he's not going to do anything for us. Yeah, although I will say, Marcy, I don't think you've been here for a show where I vented about this, but there were no favors done, again, by Democrats in the General Assembly this year who let people run bills who have no business running bills. And I don't just mean the elected, I mean the lobbyists behind it. Like, oh, God, so just some real gross stuff this year. And if the administration were willing to compromise with you, reach a compromise on a bill, and let's say you just refused to meet with them, do you really think they're not going to tell people that you refused to meet with their office, even though there was a compromise on the table? Because they tell people. And your secret's not safe with me. So good luck running for office. That was fun. I hope you all enjoyed it. Hey, I hope everyone has a good weekend, whether you're enjoying a tropical storm or not. I think we are still sort of enjoying that here. This has been a blast, and we try to do this every Friday. So make sure you hit that like, follow, or subscribe button so you never miss when Normal goes live. Hey everyone, have an awesome weekend. And as always, I'll see you right back here next time. Bye bye.